I really like learning. I was the person in school that made the class last too long because I had too many questions about everything. And especially with nursing, like I've wanted to be a nurse my whole life. It is my passion.
Hey, hi, hello, and welcome to the Queer Vision podcast. I am one of your co-hosts and co-founder of Queerolina, Coe Star, or Coe of Kanekalon. This is your other co-host and co-founder.
Hi, I'm Becca.
We are the Queer Vision Pod. Today we sat down with Nurse Nikki, better known as Nurse Nikki's Novelties or Nurse Nikki's News Network. She works a lot within the queer community and the nursing and healthcare field, just trying to create more space and education for queer people and for the average nurse worker and for other people in the healthcare field to learn more about queer individuals and how to make their care more accessible, inclusive, and comfortable for queer people. Because if you're a queer person, you've probably experienced uncomfortability in an ER or in a health facility. And yeah,
We need to fix it.
we
So
do.
you should listen and you should go to the resources and you should share the resources and let's work together to fix this issue.
Thank you for sitting down with us on the Queer Vision podcast today.
Thank you for having me.
Of course. So, if you just want to introduce yourself to the people, just let them know a little bit about you and your name and your pronouns and all that fun stuff.
Okay. My name's Nikki. She, her. I am a nurse in the emergency department currently. I actually did just get a new job in case management, though. So I'm pretty excited for that because all that is advocacy. So I do like arts and crafts and stuff that I sell at like prides and different like festivals and stuff.
Good.
So so I give out things at work like different resources and shows of support for other like nurses and people in the healthcare field to wear. And so I work at multiple different hospitals because I'm part of the resource team in the ER. So whenever I go to work, I see people with like "You're safe with me" pins, and I share them with like EMS and like the environmental services team, like the people who clean stuff, registration. So like every time I go to a hospital, I'm like, but it feels good to help with that. It also feels good to make things that help people express and empower themselves, which is what my little like slogan for my Nurse Nikki's Novelties is. Um, but recently I'm in my master's degree, and the main reason for pursuing my master's degree was to get higher education in order to basically have more clout in the community and be like, hey, I know what I'm talking about. I can do research and things like that, and to be able to like make some changes, some much needed changes in the healthcare field. So that's
Awesome.
pretty much me in a nutshell.
Yeah, that's amazing.
I talked to my therapist about it this morning because my I don't really want to like name the facility where I work, but where I work is ending some transgender care, like gender affirming care for all of their hospitals, and it's really frustrating. There is a petition to um, to like add your name to say like we don't think this is okay, but yeah, it was just really disheartening to hear that about the organization that I've aligned myself with. So
Right.
I have to figure out my next steps from here, but we'll we'll figure it out.
That is a hard place to be, honestly.
Yeah,
Especially right now when
Mhm.
a lot of things are getting pulled back because they can and because it costs money and because
right. And the thing
whatever
is,
people actually want to have.
yeah, my thing is that the mission statements and things that exist for this organization say words like "for all" and things like that. And there was actually, I'm trying to find it because I thought I took a screenshot of it, but an email from the chief executive officer saying that despite changes in the government, like things were not going to change at this organization, and now they are.
Mm,
So I kind of just wanted to like throw it back in his face. Um,
Yeah.
yeah.
and
No.
kind of call out like if you're gonna do this, you need to change your brand, because you can't say for all and then be like, oh well, we didn't want to pay the fine. It's like, okay, you guys have
Mhm.
Yeah.
probably like, it's, I don't know how many hospitals, but it's between the Midwest over all the way to the like east. So there are a lot of hospitals and there are a lot of people and there are a lot of different states involved. But because of this mandate or law or whatever of the not giving gender affirming care to people under 19, they're changing all of the hospitals, like all of the organization across the whole thing is just going to stop doing gender affirming care for people under 18 or 19. And then there was an article that it was like they they were going to stop giving people their gender affirming care if they had started after 2023. But there is an article saying that the the clinics themselves are like discontinuing it, so it doesn't matter when you started it or not. If you're going to that clinic within this organization, then they're likely going to stop it.
Oh, brother, this guy stinks!
So, what
That's
do we do?
yeah.
What do we
That's
do? That's the question.
it is such a frustrating place to be, and just I can only imagine like in your position, like being in the health field and like trying to figure out what's best. But I will say, like, don't be too hard on yourself about it. Whatever happens, like, we're all in this system, and I know we don't like really know each other, but I'm like, I feel like
Yeah,
it's really easy to get in those and like feel like you're a bad person or playing a role. But I feel like some things are
because I work for this
just that's
organization and they've changed their stance,
yeah,
Yeah.
and
and
yeah,
that isn't on you, and
It's out of your control to a point. Like, all you can do is do the best with what you're given, which either means
yeah,
like finding another space that actually is doing the things that you care about, or if you can't find that, making the best with what you are given and hopefully be able to make change in the future at this
right.
place.
So I have to stay with this organization for a year to finish paying off my bachelor's degree, because they did like a, like you have to sign something that says that you're going to work there for us, you know. And so I signed that when things were still, aligned with my personal values. And and so that makes it kind of difficult. But I also feel like I can probably make differences from within the organization as well, just by,
yeah,
especially being in case management. Like,
mm-hmm.
who gives people resources? Case managers. So,
Yeah.
and because I have worked in the ER for so long, I and my friends there know that I'm going into case management, so they can come to me and say, like, what resources have you found for this? And I've already been digging up resources from everywhere, which I sent to you guys. I made like a
Yeah.
little like magazine thing. I have to figure out how to get it printed, but I would like to be able to like give them out and allow people to carry them around, because I was going to make them like a A6 size, like half a sheet of paper, so it could be
Mm-hmm.
something that you just like you keep in your car, or you bring to work with you. And then if you're in the healthcare field and you have a trans patient who is either like having a mental health crisis, or they're just scared about like what's coming next, you can say like, hey, like reach out to these people, or search, or reach out to this organization, reach out to this company that's like privately funded, that is offering help for transgender care. And then there's like a lot of therapists that specialize in gender affirming care, or just like the LGBT community as well. I met
That's
one a
awesome.
couple. I met a therapist a couple of months ago, or like last month, um, and she is a therapist who specializes um, in like the queer community that also has like neurodivergency, so like people with like ADHD and autism. And that they're very like, there's a lot of people in the queer community that have autism and ADHD. And apparently, um, if you are not straight, you're way more likely to have like a mental health or neurodivergent or something. Like you just like it's just linked somehow. And
Hmm.
that's why like the bisexual and the ADHD tropes go together so well because like bisexuals are seen as like this like, chaotic entity, and I saw a post the other day that somebody was like the ADHD like having three different drinks. I was like, that's a bi thing, but also I also have ADD. I'm
Yeah.
I on both of those things there.
It literally
But
currently we each have 3 drinks.
Yeah.
that's amazing. I only have two right now. I'm scamping. I don't have the nice. I don't have the caffeine one, but I do have. Oh, I only brought one. Oh my god, I'm a terrible bisexual. But it's Hello Kitty though. But I left my other
It
drink.
worked. Oh, that's
I'm in
cool.
my
No, that,
I'm in my cat's apartment. She has to have her own room because she doesn't like any of the other cats.
This kitty's got claws, and I'm not afraid to use them.
I love
That's
that.
adorable and kind of.
She old.
Aww.
Oh my
She's
god,
like,
okay,
put me
wait.
down.
Actually, if you want any more kittens, we found some on our walk today.
No, I have 18 cats. So my
Do you actually have
advocacy,
18 cats?
I literally have 18 cats. Yeah.
They call her the cat lady. People say she's crazy just because she has a few dozen cats. But can anyone who loves animals that much really be crazy?
So my advocacy is like I rescue animals, and then we're really bad at fostering, so we kept most of them, and and then I have a dog too, but and then I have rescued 3 or 4 kittens in the last couple months that did not end up in my house, and I'm that's okay. But I was like, please somebody, I was like, please somebody take these things from me. I do not want to raise any more kittens.
Circling back to the little like zine or magazine that you're working on,
Yeah.
that is so amazing, honestly. And
So I do technically like have the Nurse Nikki's Novelties business, which is like, um, and then I buy the pins for that, but it's become like Nurse Nikki's news. I like alliteration. Can you tell? Nurse Nikki's news.
me too.
Uh, um, yeah, Nurse Nikki's news network is like the like advocacy part where I'm not like trying to get people to buy things. I just want people to like know their resources and get connected and things like that. Um, so that there's an app called Band, and like Band like one time at band camp.
Oh,
And it's like a group where you can like make groups. It's like a group chat, but it's like a kind of like a Facebook forum. Um, and so I can like post files and things there, and people can have access to the files because I don't have my own website yet. I'm working on it, but that's kind of my like precursor to like letting people know what I'm doing. And I posted all the stuff that I sent you on there. So if people want to reach out and get like the QR code to join the band after this, like I'm totally cool with that because then they can reach out to me and say I'd like to help in this way, or they can just like see what's happening and like what I'm up to in that realm.
okay.
That's
Yeah, I
pretty
mean,
awesome.
if you want to, we can put the QR code in your portion of the magazine, like that little chunk that we're going to put this interview in,
Yeah.
so that people can see it. And I'm definitely
Yeah.
going to take your resources and look through and see like what we have similar, and take some of the ones that you found and add them to our
Yeah.
resources too.
Well, some of them are from the Queerolina website because you have your resource like page. So some of them I got from you, and actually this is crazy, but there is a it's GLMA, the Gay and Lesbian Medical Association, that I didn't know about until I started looking up resources, and then I found out they have a conference in October in like Minneapolis or something like that, and they were offering scholarships for people to go because I mean conferences are normally like $700, $800, and my organization will reimburse me for education process programs, but I have to pay like ahead of time. And so I was like, that's a lot of money, because I wanted to go to the National Emergency Nurses Conference as well. Um, but I got scholarships for both of those. I applied for scholarships for
Wow.
both, and I got both of them. So I'll be going to a conference in October that's specifically for queer healthcare providers.
That's awesome. Whenever you get like information too, we'd love to share it on our
Yeah.
website or in the magazine or something like that too. So like, please stay in touch when you go to these these places.
Oh, absolutely. I'm so freaking excited, because the Emergency Nurses Association is also very, very um, supportive of the queer community, because the president is gay and the incumbent president is also gay. And I know both of them, and they're both amazing, amazing humans. And they posted, like Happy Pride Month at the beginning of June, and there were many, many nurses that responded like, you know, we don't celebrate pride. It's like men's mental health awareness month or something like that. And it's like,
It can
okay,
be
well, it
both.
can be both. Yeah, exactly. Like there are queer men that have mental health problems that they can
Yeah.
celebrate mental health awareness, I guess. But like, it's just so silly. They're like, I just don't want it shoved down my throat. And it's like, okay,
Girl,
who
chill.
where is this happening? Like, how is it being shoved down your
Yeah,
throat?
for real, that part.
You saw a rainbow? I'm so sorry. Like, the road was closed and people were all like happy and like sharing love and like being together and stuff. Like, I'm sorry that you feel like that's like a personal attack on you, but
No.
I
you
also
know,
just don't understand this whole like you're shoving it down our throats thing. It's like, bruh, like
It's
I,
so
I don't
we're
know. It's
tired
literally
at this
holding,
point.
I'm
yeah,
literally holding hands with my partner,
yeah,
like
yeah. Or like it's like, aren't you the one that says, "Oh my God, it's his little girlfriend" when they're like 3 years old and are holding hands because
exactly.
they're toddlers?
They're sexualizing people like that. And then they say that we're grooming people, and it's like, okay, if we were, then any people who are queer and have kids, their kids are going to be queer too. And then how come straight parents can have queer kids then, if it's like,
Yeah.
if it's a grooming thing? And it's like, oh, well, they're going to all these
Yeah,
liberal schools and they're, the internet and whatever. It's like, okay.
indoctrination.
I'm advocating
Exactly. But you can be
that.
indoctrinated towards anything. But like, the reason people are like, oh, there didn't used to be this many like transgender people. Yes, there have. There didn't used to be that many open transgender people, or people
Yeah,
that felt like they could do that they could actually like be their
yeah,
authentic selves. And it's amazing that it's so
exactly.
much more like normal now. Like, yes, there's a lot of hate around it, but people are still feeling
It also seems like not. Oh, sorry.
oh no, you're fine. It's just more like widely accepted, even if there are, oh, my internet is being stupid apparently. Did I come back?
You're good. You're good.
Okay. It was like, your internet sucks. I was like, no, it
Yeah, you
doesn't.
did.
I
Just
haven't
just
moved.
start that little bit over.
Yeah. Yeah, I just don't understand why people are so crazy about it. Why people are so obsessed with other people's genitals.
Same.
Like, stop it.
No, that part.
Honestly.
That part.
Yeah. Yeah.
I was gonna say, circling
Uh,
back around just to like your work and like conferences and stuff. It
yeah.
seems like I don't know. I see you like light up when you talk about that kind of stuff for sure. Do you? I don't know. Do you seem like are you like a learner at heart? Like, do you love like just learning more about I don't know. Like, you just give me that energy. That sounds like such a stupid question now that I'm saying it out loud.
It's
But
not.
I'm like, I don't know. You just seem like you like getting information about things. Like, you seem like one of those people.
I really like learning. I was the person in school that made the class last too long because I had too many questions about everything. And especially with nursing, like, I've wanted to be a nurse my whole life. It is my passion. And
Mm-hmm.
I've just wanted to be um, somebody who can like help in any possible way. And so when I go, the first time I went to a conference, it was like I think it was like 2022 was my first time going to one. And I was just listening to these people talk, and they were all ER nurses. And they picked topics like that they were really passionate about. Like this one woman talked about how you can't trust your drug dealer or something like that, where she was talking about all the different things that get put in recreational drugs, and how like dangerous the stuff that's put in the drugs are, and it's more about like what's it's being cut with than what actually is, because the new fentanyl and stuff has been like, when I give somebody fentanyl in the hospital, they're like, oh my god, you're trying to kill me. I'm like, literally, I got this out of the Omnicell. I didn't get it off of a street corner. Okay, like, you'll be okay. It's literally going to last in your system for like 15 minutes. And they're like, well, you have Narcan, right? I'm like, yes, we have Narcan, but you're not going to need it. They're like, well, they said the new fentanyl, and it's like, that's not what I'm giving you for pain relief in the hospital. Like, um,
Yeah.
and so like, but fentanyl can be cut with like all these drugs that have been deemed unsafe by like the FDA and things like that. So they can be cut with all these like old meds that we don't have in the US anymore. And and those can cause like different side effects that like make people feel like a better high or something like that, but they're incredibly dangerous. So she was really, really passionate about that. And then there's people who are really passionate about like trauma care. There's people that are really passionate about resources for nurses themselves. There are people who are just passionate about all these different things. And I was just sitting there like enraptured. I was so stoked to be around these people that actually cared about what they were talking about, because we have all of this mandatory education that we have to do every year, and the people doing those, they don't care about what they're talking about. They're just there because it's a mandatory class.
I like the way that you phrased, I don't know, like just like bringing light to the feeling of when you're like in a room with people that actually are passionate about the things that they're talking about.
Yeah,
Because I feel
yeah,
like we so often, like, one, don't talk about that experience, and two, like, are drudging through life in a lot of ways. And so many
yeah,
people around, just so many people are drudging through life, honestly. Either it's, doing tasks that they just don't feel called to do, but we all have to do, like adulting
like
stuff,
just
or it's just
surviving.
like, yeah.
Yeah.
And so I don't know, it really is a different experience when you are in a room and you're surrounded with people that like actually enjoy the things they're doing in that moment. I feel like that's one of the things I've even experienced with like drag and like performing and entertaining, is like you can see when like somebody's actually passionate about something, and
Oh yeah,
seeing people do what makes them genuinely happy is, yeah.
Yeah, it's
yeah.
like the difference
I
between going to a TED talk and sitting there listening to like a professor who doesn't care about their life anymore.
Right. Yeah. It's like that. Exactly. And I went to the national conference in 2022 as well, the National Emergency Nursing Conference. And I came back just being like, I know all of these new processes and like different things that are like coming to the medical field, like new changes and things like that. Like, I know them like way before they're happening, because I'm going to all of these conferences and things like this. And so like somebody will do something and I'll be like, hey, actually that's not supported by the literature anymore. And then they're like, well, we've always done it this way. I'm like, we're like, healthcare professionals should never say that, because we always did something some way until somebody decided that there was a better way. And that's what science
Yeah.
is. So I would like come to the provider and be like, hey, like look up these studies and like this all these studies saying that you should be doing XYZ instead of this. And then they're like, oh, yeah, that is new, but it's not like our policy yet. And I'm like, well, make it so. It's better for the patient. But we were talking about conferences and learning things and being involved with people who actually like care about what they're talking about and things like that. So um, yeah, I went to the national conference, and I just like was just so excited and was like, I need to like be one of these people like talking at these conferences. And so I started drafting ideas and trying to get like studies done and stuff like that. And I was going to make a new education model for the emergency nurse, or for the emergency room, basically being like, there's for some reason people are uncomfortable asking people their pronouns in triage, right? And that's stupid because we ask
Mhm.
people the most uncomfortable questions as ER nurses. Like, when was the last time you pooped? When was your last period? Why'd you put that in your butt? Like, things like that. And it's like, we have no problem with that,
Bro.
but we have a problem asking people, what are your pronouns? Like, come on. Yeah. So I wanted to have testimonials and like people um, within the community that are not cisgendered to come and talk to people like medical people and be like, hey, like when you do this, this is how you make me feel, like whether it's a good or a bad thing. Say like, so when you dead name me, you make me feel like I'm not important and that you don't respect me and that I don't want to do anything that you're telling me to do. But when you affirm me, you
Mhm.
ask me my pronouns and things like that, that makes me feel like part of my care and involved and everything like that. And and it's very much tied into mental health because you're you're dealing with a population that is being ostracized and being discriminated against from the very highest level, from the government level. And so we're not supposed to like put our personal biases in. Like, this is strictly professional, and everybody that comes in is supposed to be treated with the same level of care. And if I'm calling this person the name that they want to be called, whether they're cisgender or not, why shouldn't I be calling the transgender person what they want to be called and referring them how they want to be referred to? So I'm working on that, but
Mhm.
it got it got like, we're not going to pay for mandatory education when we already have it. And I was like, a PowerPoint that you click through that was obviously made by a straight person is not a good education model for healthcare providers. I've been working on that for over a year and not gotten very far. But what I have been able to change is that nurses used to not be able to change the preferred name in the chart. And now we have access to
Mhm.
do that. So we don't have to go to registration to do it. And that
Oh
saves
wow.
time, which means that nurses are more willing to do it if it's not like something that you have to take an extra step to do or involve
Mm.
somebody else. And and
Yeah.
then the wristbands have the preferred name in quotation marks where it didn't used to before. And it's right after the first name, so it's not like at the very end of everything, but it's there, so it makes sure that it fits. Um, and it does it for everybody. Like my birth name is Nicole, but I go by Nikki, and so my wristband would say Nicole Nikki,
Mhm.
and so people know I go by Nikki. And
Mhm.
um, yeah, so it's that kind of thing. Like, those are the small changes that I've been able to make happen. And then there was a an ER nurse who submitted a study about doing basically the same idea that I had in a hospital in Florida. And I sent him a message and I was like, how can I like get this going here? Like, do you have any advice or anything like that?
Mhm.
And he basically told me to start out by just empowering the people who are already advocates and like already on my side. And
Mhm.
so that's why I started just doing the thing where I like laminate um, these cards with like gender neutral things and gender affirming things, and say like, this is the outdated term and this is the respectful term, and this is like the group of people, and this is the kind of like things that they either might be taking or like their surgery goals in the future. And then different resources that nurses and doctors can use to improve their education about the population. And then like a tip for when you're triaging patients on how to not get an argument about pronouns if somebody wants to start an argument about it.
Wow.
That's amazing, honestly, because it kind of, goes back to the education piece of how, like, if nobody's ever, you have to, like, realize that some people were never taught these things and they don't
Right.
always understand. So it's good that, like, it's good to see you like seeing that and being like, okay, here, let me just provide the education if you don't already know these things, because I think
Right.
that's where a lot of people are left in the dark and then end up being, I don't know, either offensive and they don't mean to, or more likely to be offensive even if they are trying to be. I don't know.
Yeah.
But
Yeah.
And it seems you said like that's one of the small things that I was able to do, but like that's not small. Like I mean, yeah, it's like a smaller thing than like being able to fully make sure that everybody has the care that they need, right? But to somebody that's like the most important thing, right? Like for people that regularly get misgendered or aren't or use their dead name and stuff like that, like this probably means more to them than you'll ever know, that like they're going to get care. They're already sick, they're already frustrated, they're already scared, whatever is the issue. And then instead of being treated subhuman, they're respected for who they are. That's a
Yeah.
huge thing.
Right. And I try to get people to understand that simply using the correct names and pronouns, like whether you mean it or not, simply using what they want to be called by is enough to ensure that the patient is going to be more likely to do the follow-up care and use your advice and trust you with information and things like that. Like you don't have to agree with it at all, but you're in the healthcare field and you're supposed to be giving the same ethical care to everybody, and that involves respecting their identity. So, I mean, the I pointed out like Maslow's hierarchy of needs, like the bottom, like absolutely like necessary thing to survive is just like food, water, rest, whatever. But the next thing is identity. So your sense of self. And that is so close to just the basics of like how to live. If people don't respect who you are, like why would you want to live anymore? And I think that's why we're getting into this situation where you're coming up against a population that is already more predisposed to having mental health crises, and then you're making it so much worse. And then you want to say that you care about kids and you care about, you know, the futures and stuff like that, but you don't care about kids because these kids are going to see this bill coming out saying that they can't get any help for anything in with gender affirming care until they're 19, and they're going to be like, I don't know if I can make it to 19. And
Exactly.
that's awful. But there is an organization called PATH. I think it's called like providing access to trans healthcare. I put it on my like my resource list and stuff like that. But they help people get gender affirming care with like and all the stuff that goes with it, like the name change and everything like that. They help people get to those resources. Um, and it's a great program, and they can actually offer like financial aid as well. So I don't know how tied they are by the laws right now, but you know, maybe they have kind of like the abortion network type of thing where you can go to a different state and get the care that you need, and they can help people do that.
Oh,
yeah,
But
that part.
that's amazing. That's a good resource.
No,
for
yeah,
sure.
it is like the little things that really do add up and make the difference. So like props to you for doing that, and thank you for doing that. Sorry, my brain is like also leaving me, so I'm trying to.
Totally
I
understand.
did have one question for you. As
Yeah.
as a nurse, there's been something that like I've been wondering about for a while. So we learned forever ago, right? Whenever I took CPR class like in middle school, they were like, okay, these are the symptoms of a heart attack, and they're like pain down the left arm, stuff like that. Then I think whenever I was in like college, maybe, they were like, actually, women experience heart attacks completely differently. That's why they're like one of our leading killers. That it's more like
Mhm.
heartburn.
Yeah.
And so my question that I've been trying to figure out is for trans people, would it go more with like what their hormones are, right? If they are on hormones, or like how would they see or how would they experience a heart attack? Like, for example, if you have somebody come in that is like a very passing trans woman, would you know to look for a heart attack a certain way? Like, what, how would you go about that? I don't know what
So
I'm actually asking,
no,
but
I
yeah.
understand. I understand what you're getting at, I think. I think the reason why it's really important to make people understand that we are open to asking their pronouns and using their pronouns and their name and stuff like that is because it is important to know what organs they still have, and what organs or what surgeries they've had and what hormones they're on, because hormones, like if somebody's on estrogen, they're more likely to be having a PE than a heart attack if they're having those symptoms. So a pulmonary embolism is a blood clot in the lungs, and estrogen increases your risk for blood clots. And then testosterone is going to increase your risk for other things,
Lovely.
a lot of heart related things as well. So it's really important to have a receptive and respectful attitude in triage, so that person will tell you, you know, I've been taking estrogen for X amount of time, or I just increased my dose, or I got off of it and got back on it again. If they're a smoker, if they're overweight, that also increases their risk of having a pulmonary embolism. Um, and then for like um, I think that I think it's probably a component of both, because everybody has testosterone and estrogen, right? And some women do
Right.
experience heart attacks in that classic like chest pain radiating down the left arm and stuff like that. And there's actually diabetics, old people, people of color, and um, women all kind of have that like light chest, like maybe they feel like it's just heartburn type of thing, and they all experience it kind of differently. So what we do in triage, if you have an experienced nurse, they can kind of say, okay, well, based on your history or based on the medicines you're taking or based on whatever, I think that it's important to get an EKG at this point. And so a lot of times when people have upper abdominal pain, they'll get an EKG just to make sure it's not a heart attack that's not presenting like chest crushing chest pain, like an elephant sitting on your chest. And sometimes people are just short of breath. Sometimes people are just a little like nauseous and anxious. And I've seen a lot of like just arm pain or just like jaw pain or something like that. So we kind of have all of these like landmark um, symptoms that are like across the board, but we don't say like, oh, if you're having heartburn symptoms, but you're a man, it's probably not a heart attack. We'll still do the EKG and draw the blood work as well, because you can have a STEMI, which is one that shows up on the EKG, or you can have an NSTEMI, which is one that only shows up in the blood work. And so troponin is something that tells us if the heart muscle is leaking enzymes into the blood, meaning it's having an attack, like it's being damaged. So we check that and we get an EKG. And then that tells us like where we are and like, are we really worried, or are we going to check other things? So that's kind of the reason why most symptoms these days get like a full workup. Because even like upper back pain can be a heart attack too, but it can also be like a gallbladder problem, or you know, something crazy. But yeah, a lot of just like looking at people and being like, there's something not right about this person, and just understanding that people know their bodies, and if they tell you something's not right, then it likely is not. But in the ER, people need to understand that what we're doing is ruling out life-threatening problems. We're not like giving you a full like, oh, this is exactly what's going on with you today, and this is what you need to do, and blah blah blah. So that's another issue
Right.
with everything in the government, is that with what the changes that are coming from Medicare and Medicaid, there's going to be a lot more people that rely on emergency medicine for their only source of care. And we need to be ready for it, and we need to be supportive of people, and people are going to be really upset and really scared and really stressed, and um, we need to be there for them. Like, end of story. It's super important to know
Go
what
ahead.
people are taking, like if they can get pregnant, if they can't get pregnant because they had a hysterectomy, or like how likely different issues are going to be based on where they are in their journey, or where they want to end up in their journey. And there's a place to like have all that in the chart, where you can say like gender assigned, or sex assigned at birth, and then you have like gender identity, and then you have like how they look based on they how they identify, and then you can say like what their future plans are for gender affirmation.
That's awesome.
But they're all just little like places to click.
Yeah, that's awesome that actually, like, as a queer person, just hearing that makes me feel a little bit better, like that there are at least spaces for that kind of stuff.
Mm-hmm.
Yeah,
I feel like I've just learned so much more about our bodies than I ever knew. This is like a time 2 years ago when I realized that the reason that they can see if you're pregnant by your urine is because your urine is from your blood. I didn't know that.
I don't know that I knew that either.
And that's amazing.
Yeah.
That's fantastical.
It's all urine is just like stuff that gets filtered out of your blood, that goes through your kidneys, that gets excreted through your body.
Crazy.
That's insane. That's terrifying, honestly. Though it does make a lot more sense now. I mean,
well,
trips to the emergency room make a lot more sense than they did in the past.
Yeah. The body is much more intricate than you think it is. Like, everything is so connected, and people don't realize that like issues with the kidneys affect the heart, and issues with the lungs affect the heart. Issues with the liver affect the digestive system, and like things like that. Like, it's people don't realize like how interconnected everything is. And yeah, it's insane in there. Like, it's a crazy world in there.
No, for real. Same. I think we are rounding closer to that hour mark. Sorry for all the like disruptions in this. Like, this time, I feel bad that it's been that way.
It's the luck of the draw with technology.
No, it really is. Was
Yeah.
there anything that maybe we didn't touch on that you wanted to like bring up, or
your socials and stuff too, if you want to share?
Oh yeah, my socials are Nurse Nikki's News Network at gmail.com. You can email me. I have, like I said, the band app, and we can put the QR code in the magazine. And then Nurse Nikki's Novelties is my crafting business. I have Facebook, Instagram, Blue Sky, and TikTok. And if you go on like my Facebook or Instagram, you can get the links to the other two things, because it's like Novelties is like NVLTS in some of them because it was too long. But yeah, so they're kind of interconnected. I post stuff about like Nurse Nikki's Novelties to my personal page, but I don't post it to the Nurse Nikki's News Network, because I'm trying not to like be like, oh, if you support this, then buy my stuff. I want it to be more like advocacy related, but I will post the advocacy stuff on my like business page.
Well, thank you so much for sitting down with us today and educating us and the people so much, because I feel like that is another thing. I feel like a lot of us as like queer folk don't really know a lot about the healthcare system, and maybe that's just me speaking from my own bias, but I feel like there's definitely a large group that we don't really know, and we don't know a lot about.
Well, why would you want to go if you were going to be disrespected the whole time?
And thank you for explaining why it's so important. Yeah, and thank you for explaining that. Like, that, because I don't think a lot of people realize why it's so important to be respected in that way, and how it can, like, being disrespected can really lead to basically just having health problems out the ass, because you just don't want to go to the doctor if they're going to be rude.
Yeah, exactly.
And everybody deserves care.
But yes, this has been great. Thank you so much for sitting down and also dealing with all the technological troubles.
Yeah, thank you. It was really
Of course.
enlightening.
Yeah. Well,
Yeah.
enjoy the rest of your
Anytime.
Friday, and we'll talk to you soon.
Yes, have a good Friday.
Yeah, have a really good day.
Bye.
Bye.
Thank you so much for listening to this episode of The Queer Vision and learning more about Nurse Nikki. You should definitely go to her socials and check out all of those amazing resources that she's come up with. Yeah, and support everything she does because she's doing some really great advocacy out there, and we need it. Yeah. So thank you. And again, I am Becca, and this is
Chloe.
And thank you for listening to this episode of the Queer Vision podcast.
And as always, you can find us at Queerolina.org, Nasty Queer, and Queer Vision Mag on all of our socials, or you can just go to Queerolina.org and find all the resources and find Nikki's resources under our featured queers pages.
That too.
Bam, bam.
Thank you, ma'am.
Yeah. Okay, bye.
Learning.
Okay, cut that part out.
That should be better. Is it not?
Oh.
It took her away. Why?
Do you believe in life after love?
No.
Are you there again? Why is this so crazy?
You better not eat the needle.
Is that what it's called?
Mm-hmm.
Oh.
Yeah.
Thank you so much for.
A girl can't giggle.
Okay.
Peace. Now cut that and make it I want everybody commenting that in the TikTok comments. I need that, like the picture of you.
I hate you.